26. I'm Abigail Blackrick. Today in Traverse City, speaking with Hedy Mulvang, State Director of the Parkinson's Action Network and facilitator of Parkinson's Network North. Did I get that right?
Yes, you did.
It's kind of a lot. You do a lot. So tell me about what is Parkinson's?
Parkinson's is a progressive neurodegenerative condition in which the brain cells of the parky they sort of die because there's an area in the brain that produces something called dopamine. And the dopamine cells begin to drop off, and suddenly you find you have Parkinson's. It's a very insidious disease. And usually you've had it 6 to 10 years before you show what we call a motor symptom. And a lot of people recognize that as being a tremor, but there are several other symptoms that pop up.
Who's typically affected by Parkinson's disease? Is there an age that's more typical to see it?
Typically, it's an older person. Men, actually, it used to be more than women, but it seems that women are catching up. We seem to catch up with everything. And about 55 and older, but we have a large component of young people now. And one has to remember that we have 85,000 Vietnam vets with Parkinson's, and there's 2.1 million exposed due to Agent Orange, and 60,000 newly diagnosed Parkinsonians. And we also use the term every 9 minutes somebody is diagnosed with Parkinson's. It is growing. It will double by the year 2023.
What are some of those symptoms you were talking about that are typically seen before a diagnosis?
Before diagnosis, there are some what we call non-motor symptoms. And anxiety and depression are one of the earliest ones and last a long time. And it's something that's sort of not found. Loss of voice, loss of sense of smell. But you can get that for a lot of other reasons. However, it is a cardinal symptom of Parkinson's, loss of smell. Chronic constipation. It just seems that it's all very insidious. Small writing. You usually find that someone will say, I had beautiful writing, and now look at it. You can't hardly read it. And so there are so many of these things. Slowing, everything starts to slow down. The thinking process, the walking, all of those things begin to slow down with Parkinson's. And it's not noticed because if you are a loved one of that Parkinson's, you're seeing them every day, and it's just daily things, so you don't notice these happening.
Right, because they're kind of slow and gradual.
Slow and insidious.
And so you said that there's really no way of early detection. The symptoms are your only sign. And is there any cure currently?
There is no cure for Parkinson's. In fact, there's no blood test either. It isn't until you sort of demonstrate a little wiggling of the finger. Some people say, well, my knee started to shake. Or others will say, well, it feels funny. I start to kind of want to fall. And it's so insidious. And you do need to go and see a neurologist at that time, or a movement disorder specialist if you can find one.
So there's no cure. Is there anything that can help, at least kind of slow the symptoms?
Slow it down, yeah. We do have medication that will help, and you can take that, and it's fine. But medication in itself, after a number of years, will start to give you what we call Dyskinesias, which are strange movements that occur. But what can help, and what we do say now, is exercise, 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 and sing while you're doing it, because it will slow the symptoms. It'll sort of calm the symptoms, I guess you would say. It's not taking them away completely, but if you do that exercise religiously every day, for about 10 or 15 minutes or a couple of times a day. And I always tell everybody, if you're sitting watching telly, every time the commercial comes on, get up and run around the house. And that's a good move to make.
So that's great advice for the viewers at home watching this. They can get out and move and make a difference. So I'm Abigail Blackrick in Traverse City, bringing awareness to Parkinson's for Parkinson's Awareness Month.